go. This is a new feedback postcard. So back in April, when we met with the North Shore volunteers for Volunteer Development Day, we discussed whether or not some type of formal feedback is useful to produce a successful volunteer experience. And we wanted to know if the volunteers felt like Louisiana had provided a clear understanding of the goals, the rules, and the procedures for volunteers. And that led into a discussion about how to get feedback on our presenters from the facilities that we visit. And so it led to the creation of this presentation feedback form. For those volunteers who are interested in participating, what we'll do is we'll provide you with a supply of postcards with postage applied. And then it's going to be up to you to approach the activity coordinator or the facility director after you've completed an SMP presentation and ask them to complete a short feedback form and just for them to return it at their own convenience. You can see the form on your screen now. There's a spot for the date of the presentation and the place, so they would fill this out. A question, was the presenter on time? Was the presenter organized? Did the presenter speak for the allotted time period? A lot of times they give us a certain amount of time to speak, and so we want some feedback on whether or not they spoke for the allotted time period. Did the audience seem to understand the presentation? And then we also, would you like for SMP to come back in? And we left it kind of open to them. A lot of these places like for us to visit once a year. Some want us to come more frequently. So we kind of leave it up to them where they can let us know if they want us to come back in 3, 6, 9, or 12. And then there's a little space for comments, and their signature is optional. On the reverse side is a place for their information and the return address to SMP, and you'll go ahead and we'll supply the postage, so you'll affix that to it. Any and all feedback that we receive would be shared with that particular volunteer. So if we received something from a presentation that you did, I would give you a call, or we would do it during the yearly evaluation. When we go over everything, I would share the information that we received, and then we'll just stick it in your volunteer file. But if you think you might be interested in receiving some of these, just let me know, and I'll get those out in the mail to you. This is something new that we're going to try and just see how it goes. And if it doesn't really work and we don't get a lot of feedback from the facilities, then we'll revisit it if we need to. Does anybody have any questions or comments about the feedback form? No? Okay. All right. Well, we'll go ahead and move along to volunteer safety. We just want to take a few minutes to talk about volunteer safety. Policy 2.6 of the Volunteer Risk and Program Management Policies states that the SMP is responsible for providing safety training for volunteers. This training should include a discussion of safe work practices and methods for responding to potentially hazardous situations. So I want to open the floor to you first to see what types of safety concerns you could or you have encountered in performing your volunteer roles. Have any of you seen anything that you think would be considered a safety concern at these facilities? You want to think about what types of safety concerns you would encounter while you're performing your roles. Maybe think about when you're giving a presentation at a senior center in their meeting room. Maybe when you're traveling to an event and the weather gets bad. Does anybody have any other types of concerns that you can think of? No? Are you sure they're not muted? I'm positive they're not muted. No. So SMP volunteer work is typically very safe, though there are some inherent hazards when working with the aging network, as well as other hazards that occur no matter what one is doing, such as bad weather-related issues and driving. I am. Yes, ma'am. Miss Ann is asking for examples. So let's see. Here we go. So potential hazards to consider when performing your role of volunteer for SMP may be the absence of emergency contact information. If your information has changed lately, you need to notify us so we can update our files. Maybe the absence of fire alarms or extinguishers and sprinklers at a facility. If there are blocked exits, dangerous road or weather conditions when you're traveling to and from an SMP event, inadequate lighting, no identification of exits if they don't have the proper exit signs. You think about slippery floors or walkways, tripping hazards, unlighted parking areas if you're going to an event and it's kind of getting dark. I know the time is going to change soon, and so it starts getting darker a little earlier, and so we might kind of run into a situation where it's getting darker. An unmaintained automobile, if your vehicle isn't up to par and you're traveling to an SMP event and you have an unforeseen vehicle issue. Also, unsafe stairways and handrails. We want you to remember that you should always depart from an SMP activity or event the moment that you feel uncomfortable. We here in the office practice due diligence to make sure that all the venues are safe and free of conflicts. We wouldn't ask you to go anywhere that we ourselves aren't comfortable going. And these are usually repeat visits. We're attending the same place that we went to 6 months ago or a year ago. But however, should you at any time feel unsafe, uncertain, or uncomfortable, you should immediately leave the event and let us know. Your safety is always more important to us than that particular activity or event. Some recommended safety practices, we just have a quick list. Carry a list of helpful contact numbers for emergencies. You want to make sure that you have SMP's 877 number in your cell phone. Scan the venue for possible hazards when you get there, and if you see something that you think could be a potential safety concern, let the venue manager know of any issues or problems. Inform SMP of any safety issues you encounter so we can monitor those sites and venues that need correction. If it's someplace where we've had an issue, then we want to make sure that we know about that so the next time we schedule a volunteer for an event there, you will have a heads up. Remain alert to potential health issues affecting beneficiaries and be prepared to find medical help in case of an emergency. And this one in particular touches home for me because during one of the very first community events that I attended for SMP, I was at a booth at a health fair at one of the residences here in Baton Rouge, and one of the beneficiaries was sitting in a chair not far from me listening to the program, and he needed medical attention. He just passed out and just fell out on the floor. And luckily, it was a health fair, so there were plenty of nurses around, and they all kind of jumped into action to help him out. But we all need to be prepared to find medical help for a beneficiary should that need arise. We also want to use good judgment at all times, focusing on protecting yourself and the Medicare beneficiaries. If there's ever a doubt, let us know. If you can think of other ones that aren't listed here that maybe we should bring to volunteers' attention, let me know. Does anybody have any questions or comments about volunteer safety? Okay. All right. Well, I'll go ahead and turn the floor over to Monique, and she's going to talk to you for just a couple of minutes about the new SMP integration grant.
Okay. About, I think it was September, yes, September of last year, we received a new grant from the, it's now the Administration on Community Living, which you all probably know as the Administration on Aging. They gave EQ Health a grant to provide services to reach Medicare beneficiaries under the age of 65. Medicare beneficiaries under the age of 65 have been identified as a hard-to-reach population. So ACL has this effort to meet all of these different hard-to-reach populations. So let's see, that's one of them. Another one is they're trying to reach Medicare beneficiaries in the gay and lesbian community. And the other one is the Native Americans. Yes, they're also trying to do outreach to Native Americans. So those are the three that they awarded last year. So we received the one to service Medicare beneficiaries under the age of 65. And so what we set out to do was to develop educational materials to educate these beneficiaries on our message of fraud, waste, and abuse. And we decided to hold focus groups. So we've held focus groups across the state, and so far we have held, let's see, we held 15 groups with over 100 participants. We were in 10 different parishes. Our focus groups probably range from about 3 people to as many as 18 people in some groups. In our groups, we had veterans, retired healthcare professionals, teachers, homemakers. We had just a wide variety of people to participate in these groups. And one of the things that we did with the focus groups was we went in and we asked them a series of questions. And the whole point behind the questioning was to find out what would be the best way for us to communicate with them. So just to kind of give you an idea of some of the questions that we asked them. We asked them, how do you learn about things happening in your community? We asked them, when you want answers to healthcare questions, how do you get that information? We asked them which communication method would they use if they were trying to get something important out to people in their community. We asked them if they would create a brochure, a flyer, a TV ad, a radio ad, or a poster. Which method would they use and why? We also asked them how would they get these pieces out to people with a disability. So as a result of the focus groups, we came up with 3 educational pieces that we're going to use with this population. And the first piece that we're going to develop, which actually we've already developed, will be flyers. A lot of them felt like a flyer was the most effective way of communicating with them. They said it would grab their attention quickly and it would have not too much information on it. And if they wanted more detailed information, then they would ask for a brochure. So our first piece is a flyer or a poster. Our second piece is a radio ad or a PSA. And our third piece is a brochure. So all 3 of these education pieces will be used to target services to Medicare beneficiaries under the age of 65. Now, in developing these materials, we're not just focusing on Louisiana. This, the information that we're learning from the focus groups, the materials that we're producing, they will be shared with SMPs in every state. So everybody will have access to the information as a result of this project. Our next step in this process is to go back out to these participants that we met with in the first focus group, and we're going to talk to them about the pieces that we've already created, and we're going to get their input on those pieces. Once we do that, we'll have everything finalized. We'll finalize our brochure, we'll finalize the flyers, and then we'll get those materials approved by ACL, and then we'll have the information available and ready to disseminate to all of the SMPs. So you all probably will see some of the information. We're just not finished yet. We just kind of wanted to give you a heads up when we're done with the project. The project will not be completed until February of 2015. So you'll probably see information coming across email, or you'll hear about it in the newsletter about this population, because we will, here at Louisiana SMP, we will be trying to target this group as well to give them information on fraud, waste, and abuse. So that's it.
Okay.
Thank you, Monique. You're welcome.
All right, and moving to our next topic, since we do have a little bit of time, we can kind of give you a preview of what we heard last week at the National Conference in Washington. One of the things that was discussed on the very first day was the state of our program, state of the SMP program. And so they kind of gave us a comparison of numbers from 2012 to 2013. So what you see on your screen is the increase or decrease for complex issues from year 2012 to 2013. So, and this is for all the SMPs total, but there was an increase of 270 volunteers from 2012 to 2013. Those volunteers, we saw an increase of 513 community outreach events, and those are like health fairs, expos, crime expos, those types of events. And by having that increase of outreach events, it gave us an increase of the beneficiaries reached at those types of events by 51,999 beneficiaries. We also saw an increase of 176 education sessions, which brought an increase of 51,896 beneficiaries at those education sessions. They also saw an increase on one-on-one counselings. Those were an increase of 34,778. We saw an increase of simple inquiries, and that was 30,564. And the complex issues went down. There was a decrease from 2013 to from 2012 to 2013 of 596 complex issues received and a decrease of 270 complex issues referred. And we're not really concerned with that. I don't think there's a big concern with that decrease because it's right. We're out there educating these beneficiaries to prevent, detect, and report healthcare fraud. So the hope is to decrease those numbers. You kind of want to look at it that way. So there was no concern there with that. But that just kind of gives you a little sneak peek at the numbers game, you know, for the national SMPs. And then we also got to hear from Dr. I have a hard time saying his name, but Shantanu Agrawal, who is the Deputy Administrator and Director for the Center for Program Integrity at CMS. He replaced Peter Budatti, and we talked a lot last year. We got to listen to Peter Budatti speak last year, and it wasn't long after that he announced his retirement. But he talked about, Dr. Agrawal talked about the top fraud schemes for 2013. And so the top 5 you see here are drug diversion, billing for services not rendered, misrepresenting products and services, kickbacks, and identity theft. Those were the top 5 that they saw for 2013. He also made us aware of a current scam for Medicare Advantage plans and Part D. It's one where beneficiaries receive a phone call from a man named John who tells them that they qualify for a $399 refund due to a withdrawal that was made in error from their bank account a few months back. And what they'll do is they'll ask for the beneficiary's bank account number so they can give them that money back. And he said that those calls have been found to originate from somewhere in Belgium, but you know, we all know how they spoof telephone numbers, so it actually looks like a local call or a local number or an in-state number that's calling you, but these calls are actually originating overseas. And he said what they find is these people are making repeated attempts to get information from the beneficiaries, making multiple phone calls, but telling them that there was a withdrawal several months ago and now we're trying to give it back to you.
Very aggressive.
They are, and he said that. He said that in his speech, that they were being very aggressive with it. So you kind of want to keep that in mind when you're out there educating the beneficiaries in Louisiana that that is one scam that he made us aware of. And we plan to kind of, today was our first day back, so Monique and I haven't really had time to kind of debrief and get all of our stuff together from the conference last week. So hopefully we'll be able to talk to y'all a little bit more about that in September and maybe even have something in the next edition of our newsletter. But that's all I have for today.